Good evening to you all. Welcome to PLABIFY, the ABC.
No. Wait. I'll tell you when it's live, Insha. Wait.
Okay.
Then you start. I'll text. Okay, wait.
Done.
Yes, Insha, we are live. You can start.
Good evening to you all. Welcome to PLABIFY, the ABCs of PLAB. For Indian medical professionals, immigrating to the UK to seek out permanent doctor's job is often considered to be an alluring career path. It is a well-trodden route filled with potential opportunities for professional success and development. However, becoming a doctor in the UK does have its own challenges. Moving abroad, starting a new life in a foreign culture and language is always going to be a big and a tough decision, particularly when working in a field as complex, competitive, and technically challenging as medicine. As such, anyone considering this move will want to educate themselves on all the positives and the negatives aspects of doing so, allowing them to make an informed decision on whether it is right for them or not. Insha Arshad, one of the hosts of this webinar, along with Dr. Leena Mariam and Dr. 𝙁𝙊𝙐𝙎, Dr. Saida Fatima, we are contented to be joined by Dr. Mohammed Aqib Ashraf, working at the Government Hospital in Baramulla, Jammu and Kashmir, and Dr. Yasir Hanif, working at the Kettering General Hospital, UK. Welcome, sir. We are fortunate to conduct this webinar under SIMSA, a government-recognized association of South Indian medical students, representing them on an international platform and providing them the right exposure. So I call upon Sri Hari, the Vice President of External Affairs of SIMSA.
Okay. Hey guys, I'm Sri Hari. I am the Vice President of External Affairs for South Indian Medical Students Association. So SIMSA is a consortium of medical students for and by the medical students of South India. We try to represent the underrepresented medical students of South India. I'll tell you a little bit about the opportunities. That is, we are currently working, we are the only medical student organization to give medical insurance for all our members. And also we are the only medical student organization working with the government of India, at least right now, especially in the government of Telangana and the government of Pondicherry. Right now we head the COVID volunteer task force with the government of Pondicherry, and then we are working on a policy for planetary health with the government of Telangana. We also have a couple of research and interest groups working on. I think you can find everything on our website. So I'll just stop and let the brilliant speakers take over. Thank you.
Thank you so much, sir. If you have any doubts in the session, please don't hesitate to ask in the comment section down below. At the end of the session, there will be a post-webinar feedback form in the YouTube comments section. SIMSA members, please fill them for your certificates. Now, let's begin with a short clip from the GMC side outlining the PLAB, post which we will begin with Dr. Aqib's segment with our moderator, Dr. 𝙁𝙊𝙐𝙎.
everyone, this is 𝙁𝙊𝙐𝙎 here, and I'd like to thank Dr. Insharshad for such a brief. And I'd like to invite Dr. Mohammed Aqib. Sir, my question to you is that after your MBBS or during your MBBS course, how did you get attracted towards PLAB, and and how did you come across the PLAB, and how was your goal set up?
Thank you, Aisha. Thank you, Aisha. Thank you, everyone in the SIMSA, for giving the opportunity to speak about my journey. Well, the goal, you can say it was out of curiosity. I had it since med school to do PLAB and to go outside India for my masters and all that. But as you see, like everybody, you sometimes lack the orientation or the support. There are not enough people around you who are giving you the right information, taking you towards the right direction. Luckily, I met the right people at right time in my life. And as you know, they say birds with similar feathers flock together. So knowingly or unknowingly, I embarked on this journey, but never once did I felt hesitant in doing so, because once I began, I was very much interested in pursuing openly, going through and through. So I never really got afraid of it. So my journey towards it was out of my own curiosity and out of my own ambitions, you can say. And I always wanted to do it.
And how to go about it, sir?
Well, after you have made a decision that you are going to do something, the decision is about whether you want to aspire to do it or is it your goal. I mean, I really came across a person in my life which had asked me about it seriously. And he said, is it your goal or is it your aspiration? If it's your goal, then you have to work towards it. So once you have decided to do your PLAB route, so first thing you have to think about is your language. There is always a prerequisite for booking your PLAB one. You need your language clearance. So there are two basic exams you can give. There is OET and there is IELTS. IELTS is a pretty famous exam. It was there as long as I can remember. But OET is something which has recently come upon the scene. In India, it has started after 2019. So 2019 onwards, you can give your OET. You could give your OET in India as well. So IELTS is a pretty general exam. It is given for various purposes. All the university students have to give it if they want to pursue their language anywhere outside India, for immigration purposes, for employment purposes. So IELTS is a pretty broad exam. So generally, it is given by those people who are very creative in English. I mean, it depends on your requirement, but if you are very creative in English, so IELTS is a pretty basic exam for you. And it involves more of essay writing, and you can say it's a pretty, you have to be a very competent English person to write the exam. So certainly after you have done your med school for 5 years, it becomes kind of very difficult to do this, because you're no more in high school. You have lost your touch from English language. You kind of have read medical lingo for past 4 or 5 years. So coming back and doing all the grammar, the conjecture, it kind of becomes very messy for you to go back. So I found it, many people get very frustrated by it. I mean, they get may have to try once or twice for the exam. So the general passing score for IELTS to get a PLAB seat is to get a minimum of 7 band score. And they test you this 7 band score, you have to get across 4 different categories, because in IELTS as well as OET, they are going to grade you in 4 parts. They're going to grade you on your listening skills, then they are going to grade you on your reading skills, writing, as well as speaking. So these 4 parts are upon which you are going to be graded on. So once you have given your IELTS, many people can do it one time, and many people usually lag in writing, which is considered to be the most difficult part in the whole IELTS exam. So it was the scene so up till 2019, but after that, OET has came on the scene. OET is also known as Occupational English Test. Occupational English Test is unique to health workers only. So there are 11 different type of health workers which can go for it. So, and depending upon your occupation, if you're a doctor or a nurse or say any kind of health worker you are, you will be giving your paper. So the most of the language involved is medical language. So that is what becomes convenient to us because we are used to the lingo. We have already developed a ear for the certain language. And once we have done it, you can go do it in one go. Obviously, it is expensive, but in my opinion, it's worth it. So as I said, IELTS, you have to get at least a band score of 7 in each individual category so that you are eligible to book your PLAB and go forward. While as in OET, they grade you according to band score. They categorize you as A, B, and C. So you have to get a minimum of B score to go for further in this route. And the both are costing differently actually, but I think it's expensive. If you are want to do it fast, if you want to do it conveniently, then OET is the preferred method. And the cost for IELTS is at around 12 to 14,000 INR as of 2021. And for OET, it is at around 32,000 in Indian currency. So we have given the links in the description, I suppose, and you can directly go from there and book your IELTS and OET directly from the site.
Thank you, sir. Sir, here's the biggest question that any medical student would have, that how to plan a PLAB journey and what are the prerequisites, sir?
Prerequisites will come to first. There are basically many prerequisites, but basically you have to get your English proficiency test. As I have said, OET or IELTS, that is something you have to get first so that you can make your GMC account and get your PLAB bookings. And the preparation time for that will be at around 2 to 3 weeks, and you can get all the material available from the official sites as well. There are many online modules for that. Lots of YouTube channels which provide free YouTube content. And the most important thing for that will be practice, practice, and practice. So once you're done that, other prerequisites being that you have to have your primary medical qualification, PMQ is what it's called. So you have to have your basic MBBS degree, you can say. So once you have got that, and you will require a valid passport. A valid passport is something which is very important throughout the journey. It is a valid passport will be required to book your English proficiency tests. Valid passport is something which you have to give details while you're making your GMC account, and a postal address and email ID and certain other things which you will have to give the details to the GMC account. So once you have these prerequisites, you go onto the GMC site at gmc.org, go and set up your account on the GMC.org. And once you have set up your account, you filled all the details, and then you will be able to book a slot for PLAB 1. It will be shown in my test category, and in my bookings, you can go and book your PLAB 1 slot after you have got all these prerequisites. So once you have booked your PLAB 1, where to go from there? So first of all, you would have to understand what PLAB 1 is. There are basically a PLAB 1 is an MCQ based exam, multiple choice question based exam. So this is a test which is going to check your ability of your knowledge and applicability of your knowledge. And these questions are going to be related to UK current best practices, which will be going on over there. Okay. And the exam will contain questions which are going to be common topics, certain important topics, and certain acute conditions which you can expect to see in any accident and emergency department, or management of any long-term condition in primary healthcare setup. So these are the things you should expect from PLAB 1. And once you have done that, I think many people have this doubt that how many times is it that we can go for PLAB 1? So say if I go for my PLAB 1 and I am not able to do it in my first go, how many attempts do I get? Well, basically, as for GMC, they say you get 4 attempts. So you can get 4, and depending on your condition or situation, if you can email them and contact them, they may allow you a 5th attempt, which is a very rare case. And you have to be it has to be a valid reason. So that is a PLAB 1 exam. So it is an MCQ based exam that has to be prepared very well for.
Okay, thank you, sir. Sir, someone who is proceeding towards the PLAB, so when can someone book the PLAB 1 exam, and how can someone book the slot, and what are the cost of the exam, sir?
So the question is how to book the slot. So I have said that once you have got all your prerequisites done, you will go on gmc.org, make an account, and on that account, it will stay with you throughout your PLAB journey, 1, 2, until you apply for your GMC registration. So once you have done that, you go on this GMC account and book your PLAB 1, which is very easy, very convenient. We'll post a link also downstairs. You can go and check yourself. And the question is when to book. See, it is very important to give yourself enough time to prepare. So I'll suggest once you have got your language proficiency tests and you have to book a slot, you should at least calculate in yourself that this is this kind of exam and how much time I'm going to require to prepare. So obviously everybody is different with preparation. So in India, you can do PLAB 1 4 times in a year now. The number of the number of slots, as well as the number of centers have been increased. Before 2019, I remember it used to be conducted twice a year. Now they have gone for 4 times a year. It is done in March. It is done in June. You can have your in September. You can do it in November. And it is done in all major cities of India: Delhi, Mumbai, Kolkata, Chennai, Hyderabad. So these are centers, and these are the times of the year, and accordingly you have to plan. So I am very important in this point will be to give yourself ample time to practice and prepare for the exam. So the cost for PLAB 1 as of April 1st, 2020 has been put at around 30,000 Indian currency, or you can say 300 and 240 pounds, which is at around 30,000 in Indian currency.
Yes, thank you, sir. So how does one proceed with the preparation of PLAB 1? Like, what are the study material one should refer to, and what the average time required for the preparation of PLAB 1, sir?
Well, as of there's only one important thing, which is the most important thing being that you have to self-study. You have to put your hours. So you have to really put yourself to the mill for this exam for at least not that much, but you can do it in 2 to 3 months if you really put your mind to it and do the work. Obviously, every person is different, so you can't put a limit. So everyone is going to do is accordingly with their own capabilities. But on an average, that what I have experienced and what I have heard from others, the general consensus is at around 2 months, 2 to 3 months of good self-study, the amount of notes and the maximum amount of revisions you can do with question banks and explanations. And nowadays, there are many online subscriptions which you can go for, which provide you these question banks with explanations. We have a few, top of my head, there will be many, obviously, not mentioned, but we'll give links in the description for them. So obviously these subscriptions will cost you at around 5 to 7,000 total if you take multiple subscriptions and do multiple revisions of them, and really do maximum number of revisions, maximum number of mocks. And if you are there can be a few topics which you can find hard on the way. So for that, I'll say the reference book will be the Oxford Practicing Manual of UK, the latest edition. Obviously, that will be your Bible for practicing anyway. So the time required will be 2 months, and you have to do maximum number of revisions of the study material, which is available online via different subscriptions and platforms, and do maximum number of mocks. So that will be the ideal situation to do it.
Thank you, sir. Before we get to the next question, I would like to play the video of the GMC again. I guess, sir, there's some issue with the video. We will inshallah try putting out the GMC video in the group, the description box of the video. And let's start with our question round again with sir. Coming to the next question, sir, I would like to ask you, once a student who has cleared the PLAB 1 examination, what are the steps on the planning and the prerequisites basically for the preparations of PLAB 2?
Obviously, inshallah, there will be lots of steps involved because you will be, but you will have a lot of morale and boost at this point of time because you have already, if you have gone through your PLAB 1, so you'll be very eager to go for the next step, which is PLAB 2. So when to book PLAB 2? As you have said, it will be as soon as you have cleared your PLAB 1, again, giving yourself time to plan and to prepare in between for the exam. You have to calculate it, and then you have to plan accordingly, because this time it is going to be a little bit trickier than PLAB 1. So as soon as you clear your PLAB 1, you go to the GMC site again, you will receive your result. You must have received your result by that time in your GMC account. And once you have done that, you can this time go into my bookings, and this time all the PLAB 2 slots will show up in your account. So you could go and book for that. So cost of PLAB we'll discuss later, but where is the PLAB 2 conducted? That will be the way. PLAB 2 is not conducted anywhere except UK as of now. They don't have any centers outside UK. All the centers for PLAB 2 are conducted in Manchester, 3rd Hardman Square. So you have to go to UK to give your PLAB 2. So make sure that you count for this travel, this accommodation, all the visa expenses in the journey, which are going to be included. So once you have done that, you have to come to grips with how do I prepare for this exam? How do I prepare for my PLAB 2? So PLAB 2, first you have to understand it is an OSCE-based exam, which is an objective, structural, clinical examination. Okay, so this is going to be an exam where you're going to be facing 18 clinical, ethical, and practical scenarios. The whole point of the drill will be to reflect a real life scenario which one may encounter as a junior doctor while practicing in UK. So expect everything you can see on the first day of your work in a UK setup. So in this phase of your exam, again, practice will be very important. You need to practice, because they are requiring different set of skills. They are asking different set of skills from you, something which you are not used to as an Indian doctor, because they are going to judge you as according to current UK best practices. So you have to know their system, what their ethics are, what the requirement of a doctor is over there. So once you have got the idea and enough information about the exam, so accordingly you can make your plan. So in this phase, the most important thing many people will say is to get academy. Which academy, or how should I progress forward on this? But I think the whole scenario will very much be practice oriented. You have to do work on your language skills. You have to know how to talk to a patient, how to get history. So practice will be very important according to GMC best practices.
Sir, coming to the study methodology, can you please throw some light on it? Like, how do we study for PLAB 2?
As I said, again, practice is very important. So there are various academies in this phase. You can go and join. I'm sure we have posted links in the description for them as well. So these academies, they can really guide you through this process. These are many people go for them. They basically have a 15-day module in which you can take many options out there. You can go for one-on-one classes. You can go for online classes, which is kind of the norm nowadays. And you can also ask for lecture videos. And plus, they will give you some study material. You will be seeing in this study material, you will receive certain case scenarios, which will not be verbatim of the stations you will come to face in PLAB 2, but this will be the general idea. So you will come to understand what you are going to face in the exam. So once you have gone through these academies, and again, once you have gone through these academies and gone through the material and practiced yourself, got yourself used to this lingo and the way of talking and behaving with these patients according to GMC best practices, certainly you will start to comprehend. So these academies usually charge you at different rates. If you go alone, they may charge you more, or if you go in a group of 5, certainly you will receive some discount on their part. And again, your expectations towards exam is they are going to guide you, but I have to practice and I have to put my hours and do it myself.
Okay, so that was very informative. Sir, how does a GMC conduct the PLAB 2 exam? Like, what can we expect on the day of the exam of PLAB 2? And like, please tell us the passing criteria and how do we face the examiners?
Okay, as of because of the pandemic, as of December 2020, they have changed a little bit scenario for the PLAB 2 exam. Before, it used to be 18 stations. You could encounter clinical, ethical, and practical scenarios or stations in these. Now they have changed it to 16. So the number of stations has come down. Out of the 16, you will have 2 rest stations. So each scenario will be of 8 minutes, and you will have to complete your given task in this 8 minutes. So the aim of the exam again will be to put you in a real life setting as close as they can, and you may have to do mock consultations with patients. You may have to face acute ward scenarios in these stations, and so you may have to do counseling in these stations. So let me give you a rough idea of things. So once you are in your in Manchester and you are on the day of your exam, you will go on your day, and whatever time slot you have booked, morning or evening. Once you reach there, they will check your passport, and you will go through all the formalities. As of COVID norms, you will have to wear a mask and maintain social distancing, and they will do temperature checks, and all the SOPs will be followed. So once you enter the exams section, they have a specific section for that. So once you enter that, you will be put in front of a cubicle. So there will be a blue line, you will be asked to follow it, and you will get a number badge. So once you are in front of a door, you will get 1.5 minutes in front of the cubicle to read the instructions which will be posted on the door. So this, there will be some instructions and some patient information. So after that, the bell will ring. Once the bell rings, you have to go into the cubicle. And once you have entered the cubicle, you will have 8 minutes accordingly to finish the task, which you have already read on the door. So let me give you an example. Certainly there will be an actor inside who will be already given all his instructions. So you will go inside, say you'll have a patient named Tom Hiddleston. He will be complaining of pain and headache, pain in head. So he will be asked to examine the patient and ask his history. That's about it. And you have to go from there. You will have to talk to the patient, take his history, do the general physical examination, suggest some investigations and differential diagnosis. All this you may have to do in 8 minutes. So the whole exam will be conducted in about 3 hours, and you will get 2 rest stations in between the 16 stations. So you can take a 5-minute break, breather, drink coffee or tea, whatever. And if you want to go to a washroom, you may have to ask the examiner over there who will accompany you to the bathroom. So this will be the general overview of the PLAB 2 exam. So certainly there are different types of stations you can face. There is a clinical station, you can have ethical stations and practical stations. So clinical stations, you may be asked to simply assess a patient, take the history, suggest investigations, and formulate a diagnosis accordingly with the patient. You may have ethical scenarios or ethical stations in which you may face a scenario of a colleague who is doing alcohol abuse or drug abuse. Or you may have to face anxious scenarios where you may have to deal with anxious attenders or patients, misdiagnosed patients, and these kind of ethical dilemmas you can face in your practice in UK. And there are practical stations which can range from simply checking your blood pressure all the way to performing basic CPR on a patient. You'll be doing them on a mannequins, of course. So procedures like ABGs, catheterization, suturing, ECG reading, you may have to do. Coming to the passing criteria, I hope I have made myself clear regarding the exam. So they will be judging you passing criteria as of GMC's own site states, they will be judging you on 3 different sections. First one will be your data gathering, technical, and assessment skills. In this section, they will see how is your history taking, how good of a practical procedures you can do according to the set SOPs, what all investigations you have done which have led to the diagnosis, and coming to the clinical management, the second section, you will be judged upon how well did you how did you do while formulating a diagnosis, what was your management plan according to the patient, how well did you explain something to the patient. See, this will be a very important thing, that whatever you do, whatever diagnosis you make, or whatever management plan you have to inform the patient. The patient has to be informed always. This is a very important thing in UK practice. And the third important section, most important section, and I think which is very difficult for us as foreign medical graduates, is the interpersonal skills, because they will be asking more from their doctors in terms of patient-doctor relationship. So they will ask you, they will judge you how well of a rapport you build with the patient. How was your use of open and closed questions while history taking? Did you suggest something to the patient, or did you ask direct questions? And how did you break a bad news to the patient? Or how did you seek your informed consent? And how did you clarify that a patient was going through a invasive procedure? Or you may have to deal with an anxious patient or his attendant. And how well did you give your instructions on discharge from hospital and lifestyle changes? So these are the things, obviously, for a foreign medical graduate, these become very tough, because your interpersonal skills are not that good, because obviously our system has different focus, their system has different requirements. So once you'll be judged accordingly on these 3 different sections. And depending upon these, you will get a score. So what is the passing of PLAB 2? So see, as of 16 stations, you may have to pass at least 10 stations on that day. And you may have to meet or exceed the pass marks of the day. So what do I mean of the day? Because you will be going, a group of will be going for PLAB 2. You will certainly not be alone. There may be 30, 50 students giving PLAB 2 on that day. So all of them, depending upon what kind of station it was there, whether it was a difficult one or a easy one, how everybody performed. So if everybody performed good, so obviously the passing marks will get increased. But if everybody did average, or everybody did below average, below par, so passing marks also go down. So you have to pass a minimum of 10 stations and meet or exceed the passing marks of the day. So this can happen that you may have you may have overscored in your marks, but you didn't clear your stations. So you can do 9 stations and meet more than your passing marks, but you fail your PLAB 2. Or you can do more stations, you can do 14 out of 16 stations and not meet your passing marks, you still fail PLAB 2. So these things can happen, and this can really cause a confusion, because you are not actually don't have any experience regarding this format. Hope I have made it clear.
Yeah, so that was very clear to all of us. I hope it is clear to everybody else also watching us. Sir, I, as a student, okay, I am, as we all know, financial costing plays a major role in the PLAB journey. Could you tell us the rough estimate on the budget we could plan for the PLAB journey?
Obviously, financial planning is something very important, and most of us as med students or newly passed medical students don't take it seriously. We are not built that way, I guess, subcontinent people. But we are very, very good with money. When we really put our mind to it, we're very good to it. So you don't have to be a millionaire to go for this route. Obviously, you have to make responsible decisions when it comes to your finances. You have to plan ahead. You have to keep in mind that it will cost me, and how much, and each step is going to cost you a bit, because of COVID scenario and this recession and foreign conversion rates, it can be overwhelming at some times. And you have to consider a very big part of it is traveling to UK. So visa and living expenses and your academies, these expenditures do kind of overwhelm you sometimes. But I think if you plan yourself, if you plan yourself accordingly, and then you can obviously do it. So you have to meet this enough. You need to have enough finances to meet the visa criteria and traveling. So that is I think the most expensive part of the journey. Rest you can do it, and you just have to plan ahead, think ahead of your time, and do good your finances.
Yes, sir.
So
Thank you.
we have a slide, I think, showing the whole
Yes, sir.
expense of the journey. So my experience from the beginning, right from the beginning with my IELTS and language till I go through my PLAB 2, which includes traveling, visa, academy, everything, whole step. I think it is going to cost you somewhere at around 4 to 5 lakhs. So yeah, you have to financially plan a bit.
Okay, sir. Yeah. Sir, we have a few YouTube, like in the comment section, we had a few questions I would like you to answer. Like, sir, what is the ideal time to attempt PLAB 1 and PLAB 2 for Indian medical students? Like, is it during internship or after? Like, what do you suggest?
As I have stated, Insha, the prerequisites you have to meet first. First, you need to have your PMQ, primary medical qualification. So as soon as you have your basic MBBS degree and you have a valid passport, you can go for your PLAB 1 as soon as you have those. So if you are in internship and you don't have your primary medical qualification, I think it will be the best time to go for your language exams and start gathering your PLAB 1 material and going through this material, so that once you have gotten your language proficiency test, you're ahead of the curve. Or I can really suggest that Indian medical students or who are right in college or internship should really pick up their Oxford manual. And if they go through it, no matter how topic wise or whatever they can go through, obviously that will help them in the long run. They will be ahead of the curve.
Okay, sir. Then how do we, like a medical student, Indian medical student, build their CV during their MBBS, not after or not during internship, but while he's
The
in his
most important
first, second, all these years?
So the most important part will be to participate in extracurriculars, like doing these seminars, speaking, debates, or trying to get yourself published under your professors. So doing these kind of works obviously builds your CV. So do these webinars such as yourself and try to get yourself published in research. So this will really help your CV in long run.
Okay, and sir, can a student prepare for both NEET PG as well as PLAB at the same time, like the course and everything, the pattern?
Well, both are different exams, Insha. NEET is asking something very different from you as of PLAB, because PLAB is asking you questions which you have to answer as of UK best practices. So the guidelines are different, the answers will be different. And NEET is something I have felt and seen people, you need to put a lot of effort. It's a very lengthy exam. The process is lengthy. It takes at least 6 to 8 months of total commitment for that. So I don't think you can go in two votes in this scenario. You really have to commit yourself to one, because you will not be able to give your wholehearted effort to neither one of them. The end result will not be good. I mean, because they're asking different things. NEET is asking as of Indian guidelines and different questions. UK PLAB is asking different guidelines and different questions. So I don't think so it's a good idea.
Okay, thank you, sir. This is the last question that comes up to you. Do we need next or need clearance for PLAB, to appear PLAB, or for PLAB, the next clearance?
Next is something which has recently came into our situation. Obviously, next 1 and 2 will be included. So everybody after doing their MBBS degree has to come and get a license. You will get a license after you do your next. So certainly this has been a most asked question. But as of GMC's opinion, they don't want anything to do with next. So if you want to practice in UK, you just have to, because PLAB itself is a licensing exam, and if you want to practice in UK, they are only concerned that you meet their criteria so that you can come to UK and practice. It is not going to be any benefit that you have a license in so and so country. But if you have done it, well and good, but I don't think so. It's a prerequisite that you should have your next clearance before giving your PLAB.
Okay, So before I wrap it, actually another question came up, and it is like, how difficult, what is the difficulty level of the PLAB exam according to you?
I don't think it's that difficult. I think it's an average exam. You can rest assured. Obviously, papers can matter. Different people can pursue a different exam. It can be easy for somebody. For somebody, it can be very difficult. But my experience has been it's a very average exam. Standard is there, but you just have to meet the standard. It's not something like which is out of your reach if you really put yourself to it.
Okay, thank you, sir. I sincerely thank you for taking out your time and providing us with this exceptionally helpful and crucial information for this PLAB journey. I hope it is helpful for all of us viewing this. Thank you, sir.
As of this COVID scenario, which has reached in India, so I kind of see that all the negativity that has come into our life. Certainly, we are doctors and health medical students. So all of us are facing this negativity all the time. You go to work, you face negativity. You come, you have your relatives calling you some one thing or the other. So very much negativity. So I kind of was going through my books last night and had this little couplet. It's in Urdu. I hope I can read it right now.
Yeah, sure, sir.
So it says, "Ukabe ruh bedar hoti hai jawanon mein," which means when a desire to fly high like an eagle comes to a youth, nazar aati hai unko apni manzil asmanon mein. They see that their destiny is in the high skies. Na ho na ummeed, na ummeedi zawale ilm irfan hai. Don't be in despair, because despair is the decline of knowledge and your incline, you can say. Ummeed mard mu'min hai khuda ke razdanon mein. Those who believe in God, they are always with hope. So I hope that we are with hope through these tough times and we get through it.
That was very good, sir. Behtareen, sir. Now that we have successfully landed in UK after PLAB 2, I pass on the baton to Dr. Leena Mariam and Dr. Sayeda Fatima to take this webinar ahead with Dr. Yasir Hanif. Thank you, everybody.
Thank you, Dr. Insha. We would like to warmly welcome Dr. Yasir Hanif, an orthopedics doctor at Kettering General Hospital, UK. Dr. Hanif was also our speaker for the Delicate Neck of Femur webinar, an exceptional webinar.
Thank you, Dr. Leena. Hi, everyone. This is Fatima. So I would like to ask Yasir sir about the GMC registration. So how do we get ourselves registered with the GMC, and how do we do the EPIC verification, and how long does it take for this whole process?
Hello, everyone. I'm Yasir. Good afternoon. And first of all, I would like to thank you all guys for the meticulous work you have done. And I would really like to appraise Aqib. He has done a meticulous homework. It reminded me of all the journey I have taken so far to come to UK. So yeah, it was kind of a recap. It was really nice work. I would also like to thank SIMSA for providing a platform for all the medical students in India and in other countries. So thanks for asking a very nice question, Fatima. So if you have done a PLAB 1 and PLAB 2, but now you have to get registered to the GMC. So there are three, I would broadly categorize them as 3 steps. The first step would be to get your medical degree verified. So GMC doesn't do that. They have kind of outsourced it to another organization, which is called the ECFMG, shortly called as EPIC verification, EPIC verification. I don't remember what does EPIC stands for, but you can look it on the website. So what you do is that you make a small account there, pay the fees. I think that time it was $80. So they do your verification on your behalf. They will liaise with your medical school, confirm with the university that yes, this degree is authentic. Then the same information will be transferred to GMC that yes, the degree is okay, so he has done his MBBS. That would be the first step. Second step would be to send some of the physical documents to the GMC itself. They should not be in the email. They should be in the physical one, as I said, physical. So you can send them through through a courier service would be good. Ideally, I would say it will take 2 or 3 days for your physical documents like 𝙁𝙊𝙐𝙎, like your local medical body. For example, mine was JK Medical Board. So medical, I think JNK Medical Council. So they provided me a kind of good standing certificate that, yeah, the doctor is good. He hasn't any pending cases around after him or anything like that. So it's a kind of good medical standing certificate. And along with that, a photostat copy of 𝙁𝙊𝙐𝙎, I guess, and a couple of other documents. They will give you a list of documents that you need to send GMC physically in a courier. So once they are in receipt of that courier, they will verify it. And I think within 1 or 2 days, you will get an email that you have been registered with the GMC, a kind of welcome mail. So yeah, that's how you get registered with the GMC after you have done your PLAB exam. At the same time, you might need to pay a little bit of fees as a GMC registration fees, which will be around like £150. I remember when I paid that fees, £150. Yeah, that's how you get registered to GMC.
Thank you, sir, for that. I would like to implore on another question. How do we apply for a job, sir? And can we apply when we're residing in India? Can we apply online?
So job hunting is one of the, what I would say, a tedious process. See, you have done all the hard work. You are registered with the GMC now. So now what you're looking for is a job so that you will move to UK, start in the NHS. So it's really good thing, a good feeling inside that you're moving to UK finally now. So how would you apply for the jobs? There are a couple of agencies as well where you can get a job in UK. But the best one, which almost every doctor goes through, is NHS Jobs profile. It's a website, NHS Jobs. So you need to make a profile on that. A simple one profile, nothing difficult. Make your profile in that, put all your details, your GMC number, any course you have done, webinars, any leadership skills you have. It has each sections for all those things. So you can update your CV in a very good way. Put all the details, the presentations that you have done. If you have done any research, has your research or publication have been published anywhere in any kind of local newspaper, journals, anywhere. So it has small and subsections for each to update all the details you have. And itself on the homepage of NHS Jobs website, there are like hundreds of jobs popping up every day. We need SHO, we need trainee, we need F1, we need F2. So you can just click on the job, apply, put on some details inside, and finish the profile, send the application. So that's how you keep on applying for the jobs. Second important thing, should you be in UK? No, not at all required. Once you are done with your PLAB 2 exam, I would suggest move back to your country, start working back, maybe earn and save at the same time. Prepare yourself that you have to move UK in a couple of months. So obviously everything is online. NHS Jobs profile, NHS Jobs website is online. You apply online. Then even if you get selected and you are interviewed, interview is also online through Skype, through many other channels. Sometimes one of my colleagues got interviewed for WhatsApp. So yeah. So you don't necessarily need to stay in UK to get a job. So as myself, I was in India working and at the same time applying for the jobs, got a couple of interviews, took a job offer, processed it, and then came to the UK.
All right. So, sir, next is about the CV. What components of your CV do they really encourage, and how do we write a CV?
So as I mentioned, like NHS Jobs profile has your profile where it's a kind of CV itself. The profile, when you apply for a job, your whole profile is copied and pasted into the application. So if you are making an NHS Jobs profile, make sure you put all your details. If you have done a small course, maybe like short surgical course while you were doing MBBS, put it in. If you have done a small presentation, obviously add it. If you've done a webinar, obviously add it and beautify it and show your leadership skills. If you're good at something, if have some artistic approach, if you are interested in poetry, and if you are good at singing or anything, and you got any awards or presentations, or you have been awarded by somebody, just make sure you put all of those things into your CV, okay? And I wouldn't say like fresh graduates, they don't have much of the experience. They don't have done much of the courses. So don't stress too much on making a very extraordinary profile, because they don't expect much from you. You are a young doctor. They don't expect much from you. At the same time, you will grow in the career. So definitely, as your career grows, you will add more to your CV. So self-explanatory profile, you will know what things you will put on a particular subsection, and that's how you will constitute your good CV to apply for a job in UK.
Okay, great, sir. So we hear like some certain phrases such as training and non-training jobs being thrown around. Which one should we choose, and why should we choose that sort of job?
It's a really interesting and very important question. As an immigrant doctor, so the best thing to take up as a first job would be non-training job. There are a couple of reasons for that. First reason, you are new to NHS system. You need to get acquainted with all the systems, policies, how things work in UK. Definitely NHS is different system, one of the topmost medical systems in the world. So there'll be a lot of responsibilities on you as a doctor. So you need to get very well versed with each and everything, how the trust policies, hospitals work, how you communicate with your colleagues, with your patients, with other colleagues from other departments, how things work in NHS. So all those things you need to learn. So you can't learn all those things while you're working in other country. So the first thing would be to take the non-training job, because it gives you kind of flexibility to understand the system properly, to understand the lifestyle in UK, and at the same time will give you enough time to build a very good CV. Then you can apply for a training job. Once you are well confident about your skills, your medical knowledge, you know the system very well, then you are ready to take more responsibility as a training job. So yes, definitely, I would go with the non-training job first, and then explore all the options, which field you actually want to go, make CV accordingly, get well versed with all those things, NHS system, then apply for a training job.
All right, thank you, sir. So what is FY1 and FY2? And as an IMG who finished internship in India, what is the requirement for further training in the UK?
Right. So those FY1 and FY2 stands for foundation year 1 and 2. If we talk about a medical student who has done, or a freshly graduate doctor who has done his internship in India, Pakistan, or other Indian subcontinent, if we broadly classify them, the internship will be called as F1 or FY1, and F2 is more of like giving you a target approach about different specialities. In foundation year 2, you rotate in different specialities, have a bit more responsibilities, and kind of work as a junior resident if you talk about in India or Indian subcontinent. So F2 is more of like a junior residency. But if you are an immigrant doctor from Indian subcontinent and you have done your internship and have a bit more of experience, or you just finished your internship and you are now looking for a job, you will be equivalent to F2, provided there's a kind of certificate which is called a CREST form. So you need to get that signed that you have special skills, you know how to draw blood, you know how to deal with the breaking bad news to the patients, you have good interpersonal skills with the patients. So all those things come in the form of a CREST form. You can get that signed from your consultant. So that will give you equivalent level as F2. So I would say F1 is equal to internship, F2 is equal to a bit more experience in the Indian subcontinent with the CREST form signed by your consultant.
Thank you, Dr. Yasir. Dr. Yasir, we have a flowchart here. Yeah, this flowchart shows us the different stages, and we would love if you could explain each one and especially emphasize on the specialty training because it's completely different from the Indian system.
Yeah, it looks it looks a bit difficult, but yeah, it's not that difficult. It's quite simple. I will try to explain each and every section in a detailed manner without taking much of your time. So if you start with the first one, year 1 to 4/6 would be equal to your medical school time. It's equivalent everywhere, whether you are in UK, whether you are any other country, whether you are an Indian immigrant student. So yeah, you're doing your MBBS in the first section. So that's broadly classified as medical school. Fine, good. Then we move to the next section, which is F1 to F2, which is foundation year 1 and 2. I would broadly classify this session as equivalent to internship in immigrants for the immigrant doctors for the Indian subcontinent, if we talk broadly. So F1 and F2 will be equal to finishing your internship and starting a job in any department, working on a clinic with some, with some consultant, having some bit more of experience in a particular field will be your equivalent to F1 and F2. So if you want to be getting done with the foundation years, at the end of that, you need a crest form signed by your consultant. Moving next, in the third section, where most of the target is on specialty training or specialist training. So it has 3 broad subsections, if I go from top to bottom. So let's talk about ST1 to 8. So this program, for example, by now you are in UK, you have taken up a non-training job, you made your CV, you have made your mind that you are going in a particular specialty. Each specialty has its own particular exam. It's not like Indian NEET exam where you just take a general exam and you are given the field upon your ranks. No, it's not like that. If you are interested in psychiatry, you take a psychiatry exam. If you are interested in surgery, you take a surgery exam, or you go make your CV, build your CV according to your that specialty. So things are different here. So certain specialties and certain trusts have run through program, which is the first one, ST1 to 8. For example, gynecology here, Option Gynecology, they have a run-through program. So if you had made up your mind that you want to go into gynecology, you had made your CV up to mark, you have taken a membership exam for the gynecology, so then you apply for the gynecology. And it's a run-through program. If you get selected into that, then you will start as ST1 Ops Gynae, and it goes like ST2 every year, 3, 4, 5, 6, 7, 8. And by the time you finish your ST8 Ops in Gynecology, you will be given a completion of code training certificate. Then you become a consultant, or you can apply as an associate specialist or anything like that. Next section, if you go GP ST1 to 3, it's a GP training. Most of the Indians might think that this GP is equal to GP in India. No, it's totally different. In India, you are automatically called as GP because you have completed your MBBS internship. No, in UK, it's different. You need to take a specialist training for 3 years, then you will be called as GP. Before that, you are just a simple doctor, a junior doctor. So GP, if you want to go into GP, sorry, you say something.
Yeah, so sir, what does GP stand for?
It's a general practitioner. But
okay.
Just like in India, you are called like normal MBBS or called general practitioner, but it's in here, you won't be called as general practitioner, you will be called a junior doctor. But GP practitioner is a consultant. He has undergone 3 years of training in different fields, with like emergency department, gynecology, psychiatry, and maybe general surgery and general medicine and acute medicine. So for 3 years, he has done all those trainings, and then he will be called a general practitioner. Not just like back in India, we are called as GP because we have done the MBBS. So if you want to go into GP, you will work accordingly. You will make your CV, which will suit for the GP applications. You might take small trainings, which will suit for the GP applications. File up your CV and then apply for the GP interviews and applications. If you get into the GP training, You'll be called as GPST1 in the first year. Next year, GPST2, and then last year will be GPST3. You end up consultant. See, it's very simple, as you can see. It's a 3-year training, very easy to get in. And by the end of 3 years, you become a consultant. As compared to if you see up and down, it has up to 8 years of training. So it depends, definitely. It depends, if some people that are really interested in a particular branch of medicine. Some people want to go into surgery. Some people want to go into gynecology. So they will choose according to their passion. It's not necessarily always one should go. Some people really want to get settled down early, so they choose GPST. So it depends, it varies from person to person. Let's go to the lower one, CT1 and 3, and then a break there, ST3 and 8. So as I said, like a run-through program will go from ST1 to 8. Certain trusts, certain hospitals, certain universities, and certain training programs have a break in the middle of it, which we can see it's subdivided into 2 small sections. So for example, let's talk about surgery. You have your CV built up very nicely. You know you are good to apply for the surgery training. You got selected into surgery training. So you will be given a training number, which will be just a kind of normal number, and you will start working as CT1, core trainee 1. Or if you go into the medicine, you'll be called as IMT1. One of our doctors here, she's an IMT training. She's going to start her IMT training very soon. She has been selected. So she will be like IMT1, IMT2, and IMT3 for 3 years of training into one specialty. Then there's an option where after CT3, you will become so-called registrar in India. So that's called specialty registrar. You can take a break there if you want to settle down there. Some people, they usually settle down at that level, become a registrars, and stay there like for a while, maybe 1 or 2 years. I take a kind of break for that, and do some more work. And if they feel deficient in any of the procedures or skills or anything they want to build up, they can build up again. And then after that break, they apply for ST3. And then you go with the ST4, 5, 6, 7, 8, then become a consultant at the end of your CCT.
All right. Thank you, sir. That was very informative. So, sir, about the pay, what is the difference in the pay in a training and a non-training job? And how does it increase once you go up the ladder or when we get promoted?
Well, I would say there's not much discrepancy in the pay if we talk about training and non-training job. Let's say you are a non-training SHO who has completed his FY2 or equal to internship back in India or back in Indian subcontinent. Then he has applied for a non-training job. He's in the first year of non-training job. And at the same time, one of our colleagues or one of his colleagues who is from UK and has finished his FY2 and got training job as CT1, IMT1, or ST1, they will have almost similar pay. There's no much huge difference between the pay. It will be almost equivalent. So, and as you go up in the hierarchy scale or hierarchy ladder, your pay increases just like after a normal appraisal, and after completing 1 year with the trust or with the hospital, your pay slightly increases. And that's, I think, that increment in the pay is equivalent to for non-training jobs as well as for the training jobs. So I won't say there's any difference. You won't feel any difference in the pay, whether you are a training job or non-training job. So yeah, and the promotions, as you say, if you're a non-training job, if you're a non-training job and you've been working in a particular department or particular field for a long time, definitely the trust has some responsibilities towards you. You're not getting into a training job, but you're not going to stuck at the lower level or a junior level for life. The trust will upgrade you to mid-grade, which will be like to the level of registrar, because you have worked in the hospital or in that department for a long time. So they will upgrade you to the registrar level, but that will be non-training registrar. And if you work for like 8 years, then definitely they will upgrade you to the associate specialist job. Your pay will be like of associate specialist. Your responsibility will be like associate specialist, but you will be a non-training associate specialist. So it's kind of commitment that you have been working in a hospital for a long time. You couldn't get into the formal training, but you have been working and giving all your time and energy and effort to that hospital. The hospital gives you back with the kind of promotion, and depending upon your experiences, depending upon your dedication that you've been working in the same department and same hospital, they will promote you to the mid grades, registrar levels. And if you've been working there for a long time, maybe 8-10 years, they will promote you to the associate specialist and sometimes even kind of consultant. Yeah. So, but that would be a different route. That would be the route that you have been a non-training doctor. But the things will work differently in the training job. You go every year, your kind of level increases by CT1, 2, 3 or IMT1, 2, 3. Then you apply for further higher trainings. There you go, ST4, 5, 6, 7, 8. So that gives you an edge, obviously, because you worked as a training and you have got your CCT at the end of your training. So definitely that gives you much leverage as compared to a non-training. But the pay will be almost more or less similar.
Sir, we have another question for you. Is that, could you please tell us how we're evaluated once we start a specialty training? Are there any MCQ tests or written tests that we need to complete?
Well, I would like to elaborate this question with kind of example. Yeah. So you don't need to take any kind of particular course to apply for a training job.
Right.
But you need to compete with a lot of people who are applying for a job. Let's take an example of surgery. If you want to apply for code training 1, it's a training job, definitely. There will be a lot of people who will be interested in code training job to get code training job in surgery or in any other field. There will be a lot of applications, not as much as back in India, but yeah, you need to compete. But the thing is that there's always a kind of point system basis application form. So you will get a pro forma. You know that each and every session of your medical knowledge, your interpersonal skills, your leadership and managerial skills, your extra courses or any extra degree or course that you have taken will be given value. So from that pro forma, which is easily available to everyone, you can kind of self-assess yourself that, okay, you're getting good marks so that your application is stronger. So you can apply for that exam or for that training job. What kind of courses you said, you can take any courses related to your field. For example, if I work in orthopedics, I would like to take some course. I'm not going to work all the year or waste without taking any special course in orthopedics. There will be small courses, short courses. For example, arthroplasty will be there, 1 or 2 days program will be there, a kind of workshop would be there. So all those things, they count. So definitely you are putting some extra effort to be into that training job so that you can add to your points and match yourself with the self-assessment form and see how strong your application is when you apply for a training job. Another example would be like, if I want to go into surgery, I want to show that I'm dedicated to this field, I want to be a surgeon, then the best thing would be to take MRCS exam, maybe part 1. And if you pass it, then it gives a very good impression that you are very dedicated, you want to work in the surgery, you want to go into the training. So all those things, they add to your CV. But not as such, no particular course should be, it's not mandatory to take any kind of course or anything. But definitely you want to be at the top when you compete with other people at the time of application for training jobs.
Right. So another important question is, from which governing body is our ALS and BLS course accepted in the UK, and where can we do these courses for a better CV?
All right. So ALS, BLS courses, or what we call as the emergency stuff, UK has its own council that they accept only that from. Another would be the European Council of, the ALS and BLS or ACLS. They don't accept American, they don't accept Indian or Indian subcontinent one. So if you really want to have it, if you really want to take all those small courses of ALS, BLS, infection control program, or any other those simple small courses, at this level, when you are you had just finished your PLAB 2 and you want to come to UK and get a job here, it doesn't matter much, honestly, from where you have taken all those courses. So if I give my example, I've taken ALS and BLS from India itself, which wasn't even UK approved. It was American approved, American Heart Association approved. So, but it doesn't matter, because the thing is, it's better to do something better than nothing. So it doesn't matter whether you take it from your own medical school. Your medical school will be providing ALS and BLS courses and giving you certificates. So take it from there. Okay.
Right, sir. Sir, we have another question that these acronyms that are always thrown around, the MRCS, FRCS exams, MRCP exams, what do they actually mean, and what other fellowship training programs are there?
I would be kind of blunt while answering those questions. I would just go with the hierarchy level, from a being junior doctor, then to a mid-grade doctor, and then to good specialist anywhere in India or anywhere in the world, I would say, to be more precise. So as a junior doctor, the best thing would be to take PLAB route. If you're freshly graduated, you have a couple of years of experience, even you have worked as a junior resident in Indian subcontinent. So the best option for you or for anyone would be to take PLAB route, come to UK, explore their options, work on their CVs, and apply for the specialist training. But if there's a doctor in Indian subcontinent, or as an immigrant doctor who has done his MBBS, then worked as a JR, or he has got into the training back in India or back in any other country. So he trained as a surgeon, he trained as a doctor in medicine or psychiatry or gynecology or any other field. So, and have been working in their field for a couple of years as a specialist. So for them, the best option would be to take membership exams. Like, for example, if you are a surgeon back in India and now you have decided that you want to go to UK, so taking MRCS exam will make more sense, because you will enter the NHS system at that level. For example, back in India, if you are a surgeon, you're working as an associate specialist or even as a consultant, young, fresh consultant, or you're working as a registrar in surgery, you have done your PG in surgery, the best option would be to take, and you know surgery very well. You are doing surgeries, you deal with the surgical patients on a daily basis. So for that doctor, it would be best to take a membership of a Royal College of Exam, and like MRCS, Member of Royal College of Surgeons, and enter NHS system at registrar level. So that would
one
be
of our YouTube questions was that which level is better, to enter it at the PLAB level or to enter it at the MRCP level?
As I mentioned, it depends upon your proficiency in a particular field. Okay. If you are a fresh graduate, definitely you don't have much of experience. Definitely you know a bit of medicine, you know a bit of surgery, you know a bit of pediatrics, you know a bit of gynecology and all those fields. But you're not a specialist. Be fair, be just true and honest with yourself. You're not a specialist. Yes. So definitely for those people, PLAB route would be the best one. But yeah, obviously, if you had done your MBBS, you're a specialist back in India, back in Pakistan, back in Bangladesh, anywhere. So you have a good experience, 4 or 5 years of experience in surgery, medicine, or any other department or any other field. For those people, it would be best to enter at the level of Royal College of becoming a member of Royal Colleges, like Royal College of Surgeons, Royal College of Physicians, Psychiatrists, Obs-Gynae. So it depends.
Yes, that's very informative, sir.
And the FRCS, again, it's a fellowship. So obviously, if you are a super specialist already back in India, one wouldn't take a PLAB then and come back, yeah. enter the NHS system. So for those doctors who are very, very good at their fields, have extensive knowledge in their fields, have got many publications in their field, for example, is a diabetologist back in India or a cardiologist in India, or is a super specialist surgeon in India, they would definitely take FRCS exam. It's a kind of fellowship exam, bit tougher. So it's like from PLAB till FRCS, the level of intensity and the exams get a bit tougher. So PLAB, easy. MRCS gets your nerves, and FRCS is out of your question at the moment.
Right. Thank you for the information.
Okay, thank you, sir. Sir, also many people have doubts like how do we get the visa and how do we plan it? Could you please enlighten us?
I think Aqib also discussed about how to get visa for a PLAB 2 exam. So once you come for PLAB 2 exam, you come on a general tourist visa, which is valid for 6 months. It's a multi-entrant visa. That means you can come in and out of the UK anytime you want, but within 6 months of period. While applying for the general tourist visa for PLAB 2, the good thing there at the website when you apply for the visa, they have put a special column where it mentions, are you going to take PLAB exam? So take that. That makes your application easier. They process your application a bit quicker, and they don't ask much of the questions. They just give you a visa because they know they need doctors, and they make your path easy. So this is a very good thing when you apply for a general tourist visa, and they have a special provision for whether you are going for PLAB. Only PLAB is there, so it's a very special thing. So apply for general tourist visa. You will get that within 10 to 7 days. But now it's COVID, so yeah, things have been delayed like that.
Okay, finally, sir, we want to ask the burning question that all of us have is, how is daily life in the UK and everything regarding that, the expenditure, the social aspect, all the aspects?
Very good question. I think that should have been the first question, because most of the people like me who leave their countries just to have a better lifestyle. It's very interesting. So if you are deciding that you want to go another country, you need to make sure that what are the things that you would like to do there, isn't it? It's not the job that you're coming for. You're living here, you're going to stay here for a while. Some people, they don't leave. So you need to understand which kind of environment you're going to live in, what kind of people you're going to deal with, how is the lifestyle there. So all those things you might need to think to yourself, or you need to ask yourself at one or the other point of time. Daily life is really good. People are nice, very good. Less populated, I would say, as compared to India. So yeah, enough of space for yourself. The environment is really good, clean, fresh air, fresh water. These things sound a bit weird, but yeah, they matter a lot. Having a fresh air to breathe in, it's really good. Good scenic beauty here. People, as I mentioned, are really nice. They're helpful. If you are honest, if you do a mistake, just acknowledge it, admit it that you did a mistake. I'm really sorry for that. I will make sure I will work on it. They will appreciate you. Dishonesty is not liked here. If you are being dishonest to you, to yourself, to your job, to anything, to even another stranger, then that's not welcomed. So honesty is really important here. People, as I mentioned, really good and friendly, but it gets a bit difficult sometimes to make friends. So it's always good to have kind of what we say is like colleagues who you meet up or who are working on the same field or on the same journey to go to UK. Those will be the people at the initial time. They will be your friends. Those will be they might stay for lifelong as a kind of like best friends. So yeah, but overall, I would say really good, much better, to be honest.
What about the cost of living?
Yeah, let's come to expenses.
Mm-hmm.
If you're going to take an exam, for example, you're taking a PLAB exam here. So, but you're earning in Indian rupees, or you're earning in Pakistani rupees, or in from Nigeria, you're earning in nairas. So, but if you earn in Indian rupees, and then you're coming to UK and you're spending in pounds, that's going to be a lot of burden on you. As Aqib also mentioned, like you need to plan everything beforehand. You can't just, backpack yourself and say, yeah, let's go for the PLAB exam, and you have no idea when you are going back, because you're going to stay here, you're going to eat here, you're going to commute here. You might feel a burden on your pocket sometimes, because if you have not properly planned. But if you're earning in UK, then it's totally different scene and different scenario. You won't feel much of the burden on yourself. And again, expenses, it varies from person to person. If you are a pampered person and you want to have a lavish lifestyle, then you might not end up having any saving at the end of the month. Yeah, that's everywhere. That's whether you are a millionaire or you are a pauper, it doesn't matter. But yeah, you can afford many good things that you would want it for yourself, but you couldn't get back in India or back in your own country. You can afford a very good lifestyle. good clothes, good cosmetics, and all those things that you want to have. You can travel wherever you want. So, and I would say, if you are being fair and rational in your expenses, you will end up saving very good amount of money. You can have your own car. You can save good amount of money to buy your own house as well in UK. So it all depends on you, how you spend, how you manage your budget. But overall, it's a good amount of money that you get in your hand, and at the same time, you spend good amount of money on yourself, on your needs.
Okay, great, sir. That was lovely information. So thank you, Dr. Yasir. We would like to introduce Dr. Saliha. So Dr. Saliha, we're very fortunate to welcome you as a guest speaker. She's an FY2 trainee at the Public Health England Hospital and she'll be starting her IMT, like Dr. Yasir said, IMT in August at the New Cross Hospital, Wolverhampton. So Dr. Saliha, could you please tell me a little about your PLAB journey and the foundation program?
Hi, thank you so much for inviting me to speak. So I took an unconventional route. We said in this webinar that don't take a training route, but I took a training route. I started here as a trainee, but that training is foundation training. So I would still recommend not to take up a specialty training post as job in the NHS. But this route is not very well known, unfortunately. If you remember from a slide, it was when local graduates they start as F1s, foundation year 1 doctors. That's the route that I took. So I graduated, and immediately after my graduation, I applied through the UK foundation training office and started training as an F1 doctor. And I'm now in F2, so I'm due to finish my training in August. This is a whole different route. Basically, there is very detailed guidelines on their official website that you can look at, but I'll just give you a bit of an overview. So how is it different is that you cannot apply randomly any time of the year. You have to apply a year in advance. So when you are in the final year of your medical school, that's when you actually apply for it. As an immigrant, you apply for eligibility first, which is around June to September time. And you don't need to have your PLABs. You don't need to graduate. All you need is your IELTS or your OET to apply for eligibility. And once you're deemed eligible, then you apply formally in October, and that's when you will be doing your PLABs. And you need to just finish them before you start your job. So you apply, for example, in 2019, and you start your job in 2020. That's how it works. And yeah, go on.
So you did your PLAB exams after you applied for this foundation training program.
Yeah.
And okay. So what were the other requirements? Were there any other requirements other than the PLAB and the OET?
So the only requirement is your OET. If you are a graduate, if you've graduated already, you need to have your degree certificate. If you are not a graduate yet, you need a dean's statement from your college dean saying that you will be graduating at this particular time. And that's it. That's the only thing you need. Another thing to mention here is the requirements for your language test is higher. So you need 400, minimum of 400 in each section of OET and a minimum of 7.5 in each section for IELTS. That is higher than the usual PLAB GMC route. That's basically all you need.
Okay, thank you for that. We had another question from our audience about how to make a strong portfolio when you're applying for specialty training. You've already crossed that bridge, so let us know all your secrets, how you did that.
Yeah, I think you can build your portfolio as a med student. That's how local graduates do here. But you shouldn't stress about it. So if you, whatever specialty you're interested in, if you go to their official pages, there's a scoring system. I can talk about IMT. So for IMT, you get your interviews and you get your scores, which is 60-40. So 40% is your scores. For your scores, there are different score numbers for each category. It does involve how well you performed in your med school, but that's not to stress about, because not everybody has distinctions and honors, even in the UK. If you do well, good, but if you don't, the maximum score you can get is 6 points out of 58, so it's not a big deal. You can get your publications. Publication could be a research paper, a case study, it could even be a book. And there are rankings depending on how much you've contributed towards that. A very good thing that everybody can do is presentations. You present regionally, internationally, nationally, and you get scores for that. And I think that's very easy to do as a medical student, really. And something that is even easier is your leadership skills. So if you are, I don't know, sports committee president, anything, literally anything, you get points. So all you need is a certificate from your college stating that you were at this post for a certain number of time. It's usually 3 to 6 months, and you get points for that. So this is all you need. But again, you can do all of that after coming to the UK and starting your job. Except for a distinction, a presentation, okay, that's a must. And something else. I didn't have much, but I was able to do a lot here during the 2 years. And if you get into foundation training, that is, I think that's the best path if you are set on coming to the UK, because you get a lot of support, you get a lot of free courses. So the courses that non-trainees would pay £600 for, I will get it for free. So that's how it works.
Can you tell us some of these courses that you did?
So what happens as a trainee is every hospital has a postgraduate center that supports the trainee. You will have your supervisors that are constantly at your back, and they will send you lots and lots of emails to register for free courses, which is a bit difficult to get as a non-trainee. One of the courses that I did was teaching the teachers course. So this is a very popular course here. It gives you 1 to 2 points in your training applications, depending on the specialty. Normally costs around £400 to £600 for people. It was absolutely free for me, sponsored by my university, a 2 days course, and it gave me the points and the skills. And you can also do your ALS, BLS, there is leadership courses. There's just so many surgical skills courses, and all of that you can get it for free.
Okay, ma'am, you also mentioned one thing was that your medical school grades, which was also a frequently asked question from the audience, was that, so does it really matter, the medical school grades, as well as, for example, if someone has some year backs, does that affect your PLAB? Does that affect your further training?
Regarding year backs, no, it doesn't matter. Nobody is going to ask you how long it took you to complete your medical degree. Nobody's going to ask you what your age is. I had colleagues 50 years old as working as F1s, and that's not a problem at all. Your performance in medical school does not matter with GMC registration or PLAB. All it matters is if you pass PLAB or not. Where it does matter is getting into training, any kind of training, starting from foundation training. So for foundation training, you get placed into deciles. So you divide into tens, and then they score you based on that. So you do get some points, but again, local graduates are not in first decile. They're not, everyone can't be in first decile. So it shouldn't worry you much. Again, for specialty training, if you have honors, if you have distinctions, it will give you more points. But again, not everyone has honors or distinctions, so not to stress about it.
So like how many points do you need, like at least to compete with the competition, like on average? For example, for an IMT, how many points are there and how many points do you need to get to cross that level?
So it's just like PLAB exam. It is competitive and it varies with each application. For this year, the competition was quite high because the application was open internationally. So it did not matter whether you were in the UK or Nigeria or Zimbabwe, anywhere you apply, and it's very objective. So all these scores. If we talk about the medical school performance, the maximum points that you can get are 6 points out of 58 points for the application. And that is if you are in the top 15% throughout your med school. Then it decreases. So if you have distinctions in parts, you get 4 points. That's what I got. If you have 1 distinction, 2 distinctions, so it varies according to that.
Okay, that's great. Another frequently asked question was the cost of training, and when you're in your training program, you've qualified, you're an IMT. So what is the cost that is there?
That's a very interesting question. I have been asked this question a lot. How much do you pay to get into training? You don't pay anything to get into training, foundation training. You get paid. It is a job. You are a doctor. You are an equal, and you get paid for it. The pay, one of the cons for this route is the pay will be a bit less. Roughly, you start from around £27,000 per annum as an F1, but that will include your enhanced rates and your on-calls. So it will be less than a non-training job, but obviously it will increase. And as you progress, as it has been discussed earlier as well, the progression is the same, but you don't have to pay. This is something that a lot of people ask me. You don't have to pay anything. You will get paid.
Okay, that's great. One other thing is that this, as an IMT, is it a run-through program, or is it is there core and then is there specialty? Can you tell us something, in depth about that?
Sure. So it's changed in recent years. I think this is the year that it's changed. It used to be, it is not run through. You apply for internal medicine training, which is 3 years. So your IMT 1 and 2 years will be like an SHO, which is a senior house officer. And your IMT 3 year is a bit different. There are different medical specialties. They are grouped in group 1 and group 2, depending on which one do you want to go into. You either apply after your IMT 2, or either you take up your IMT 3 year. IMT 3 year is still under discussion. They are not sure what they're going to do with it, but it would be in between an SHO and a registrar. So if you are competent enough, you will be stepped up as a registrar, and then you complete your IMT 3, and then you apply again for specialty training. For example, I plan to apply for gastro. So you similarly cardiology, rheumatology, all of different fields. So there's another step of application. Again, I would refer to the slide earlier, where there was CT 1, 2, 3, a break, and then ST 1 through 8. So that's where the break is. At that point, some people might take a break from their career, work as non-training, get some publications done, or you just jump straight into training. Also, I just like to quickly mention, it's not unusual for trainees here to take a break. Some people take a break after, so all those lines that you see here in this presentation, people keep on taking breaks. There are a lot of F2s who will take a break after F2, 2 years out of training, go to Australia, explore the world, whatever, then they'll rejoin. And it doesn't really affect your career much.
Okay, and one other thing, when you're applying and like the CV that you give, how do you verify everything that's on your CV? Do you have to show any proof, or what's that process like?
So if you were a trainee, a foundation year trainee, you have a portfolio which is online. And I think that makes everything very smooth compared to being a non-trainee, because you will have your annual meetings, you will have your weekly and monthly meetings with your supervisor. They'll ask you about certain things. There are certain tick boxes that you have to do, which includes quality improvement projects, clinical skills, and all of that. So you have all the evidence collected. And then as you, being a trainee and a non-trainee, as you continue doing stuff, you get it signed. So I got maximum points for arranging a teaching program. What I did was, there were a few medical students. I organized a teaching program for them, lasted 2 months. I got my consultant to write me a letter, which in detail explained what I did, and that's it. So it's just, you have to be smart, work hard, but work smart. So get everything signed off.
All right. Thank you so much for coming today, ma'am. Like, it was wonderful meeting you, and we really, really appreciate all the great information that you shared today. I would like to go back to Dr. Aqib and ask him, what will the onset of UK MLE affect the IMGs? Either Dr. Aqib, Dr. Yasir, if you guys could collaborate and answer this question for us.
Yeah, thank you, Lena. As of UK MLA has been a part of discussion for a while now. I mean, I remember it hearing first in 2018, since when I was just thinking about the route, because everyone was saying it is going to change, it's going to change. So if you really want to do it fast. But since COVID has came into scene, so everything has been moved back. Obviously, there was a talk that UK PLAB will UK MLA program will come by 2021. But as of COVID, on GMC's own official statement is that the academic session for 24 and 25 students, they will have to come from this program.
Okay.
Up till 24, 25, it is still going to be PLAB.
And a question especially for Dr. Yasir Hanif. Sir, how hard was it to land your first non-training job? Like, what was the process after applying? What was the timeline, and how difficult was it for you, or easy for you?
Yeah, that's a really important question. Once you're, you've done all the hard work by taking the PLAB exam, got registered with the GMC, now you have a license, and all you have to do is apply for a job. You're really excited and pumped to go to UK. I would say be patient, keep on applying for the jobs that you really like, and a rough estimation that me and my couple of my friends we have taken is that like 1 to 4 months it will take to get a job of your liking. So some people are really lucky, they just apply for one job and they get it within a couple of days. And some people are really unlucky, but I wouldn't say unlucky, it's just like taking your own time. Okay, I'm taking my time, I will get a good job. But everyone who has a GMC license, who is applying for jobs, will end up having a job. You can take my word. So don't rush, don't worry, don't get frustrated or irritated. The maximum time limit, I would advise all your immigrant doctors who have done PLAB or who are applying for the jobs, give a gap, okay? Take your time, prepare yourself mentally and financially. And I would say 1 to 4 months would be the ideal timeline to get a job of your liking, or to get a job of your liking, the place you want to land in UK. So yeah, so 4 months I would say tops.
Okay, thank you. And just one last question for Dr. Saliha. What made you choose internal medicine? Dr. Saliha.
I worked for 16 months in medicine.
Dr. Saliha,
I really liked it. Oh,
can you
didn't
just
hear me?
repeat what yeah, we didn't hear you.
Okay. Yeah, can you hear me okay now?
Yeah.
Yeah. Okay. So I worked in medicine for 16 long months, and I said I really liked it. I really liked when you get a patient and it starts from your admissions unit, and you start doing all your tests and start wondering what's wrong with the patient, how to make it better. And as soon as the patient gets better, it's just a sense of relief and satisfaction that you get, which I really liked. I basically want to do hepatology. So I don't like all of the medicine. I like gastro, and in particular, I like liver. So that's my driving force, really, to choose medicine.
Okay, wow, great. Thank you, everybody. Thank you, Dr. Yasir. Thank you, Dr. Aqib and Saliha, for this Q&A section. We highly appreciate you joining us all today.
Thank you so much. It was a pleasure.
Thank you.
Thank you, guys. Take care. Have a good day.
Thank you, everybody. Thanks for giving the opportunity. Have a good day.
Bye.
With this, we come to the end of our question answer session, and we come to the end of our webinar. Firstly, I would like to thank SIMSA for giving us the opportunity to make this webinar possible. I would like to thank our speakers, Dr. Yasir Hanif, Dr. Mohammed Aqib, and our guest speaker, Dr. Saliha Azhar, for their valuable time and contribution to such an informative and interesting talk. I would also like to thank our organizers for the evening, Dr. Insha, Dr. Veena, Dr. Aisha, and Dr. Pooja for their efforts. And a special thanks to SIMSA organizers like Pooja. Thank you, Pooja, for working with us. Lastly, our audience for an active participation. We hope you enjoyed the session. Hopefully, this webinar will be beneficial to all of us. I hope you all stay safe in this pandemic and look after your loved ones. Once again, thank you all.